Hello, my name is Vicky Keeley and I'm the Chief Exec of Sefton Carers Centre. Today is Carers' Rights Day and we've invited Sefton Children's Services to answer some questions from our local carers. I'm pleased to welcome Christine Fletcher, Locality Manager from Sefton Council. Hello, Christine.
Hi, Vicky.
Before we go into the questions, can I just ask you to give us a brief overview of what Children's Services actually does?
Yes, Children's Services is quite wide-reaching. You've got children's social care that are responsible for child protection, child in need, children looked after, which is the social work team who do all of the statutory assessments. And then you have the locality service, which is early help, of which I'm a part, and they are responsible for 13 family wellbeing centres across Sefton, who deliver lots of services for children and young people 0 to 19 and are responsible for all the early help plans.
Okay, thank you. Going into the questions now. It's been proven that young carers often come from low-income households. Could Sefton look at a scheme that enables young carers to access discounts such as travel and recreation services?
I can certainly ask the question. I can't make any promises, but I can certainly look at whether young carers are entitled to leisure passes, which I know some young people who access children's social care services are.
Okay, thank you. Do schools have to offer additional support for young carers in schools? What can be put into place to ensure that their education is successful?
Young carers are certainly mentioned in the Ofsted framework, and schools should certainly be creating an environment where young carers and their families feel safe to discuss any needs or worries they have. Good practice would be to make sure there was staff training to raise awareness of how you could recognise and support young carers in school. Perhaps an identified teacher or mentor who young people could go and talk to. Sefton Carers also work in partnership, I believe, with the Carers Trust and the Children's Society to offer a support programme to schools in Sefton who wish to deliver a young carers in school support programme. So it would certainly be worth making sure that all schools were aware that that was available. And that's perhaps something that we could help to promote through the Early Help Partnership.
That'd be great, thank you. Moving on to COVID, the government rules around COVID are not very young person friendly. Advice can be confusing and contradictory for young people, which means that they look for answers elsewhere, like social media. What can be done to ensure that young carers can be provided with the correct information about the current regulations that affect them?
Well, I agree. It's very confusing because there's lots of different stories and advice out there. I am aware that the Young Carers website has got guidance for COVID-19 and support in quite an accessible format. So again, it's probably about making sure that everybody's aware that that is out there. And accessible to anyone who needs it.
Okay. Leading on from question 3, young people obviously spend all day in school with their peers. What the young carers are asking me is if they can spend all day in school with their peers, but they're not allowed to mix outside the schools. Can you explain why that is?
I can certainly have a try. I think the government guidance is really aimed at keeping everyone as safe as possible and limiting mixing with people outside of your family home or your bubble. the government has decided that education is important and they're committed to keeping schools open. And that should be in a COVID safe way with all the children in bubbles. It must be very frustrating to think you can sort of meet in school and not outside, but it is really the aim to try and keep everyone as safe as possible and limit interaction with different people outside of your family.
Young carers are obviously very isolated more than they have been with the COVID restrictions. What support can the council put in for young carers, particularly in the rise of the mental health issues that young carers are facing now and going forward in the future?
I think, as I mentioned before, anyone can access support from the family wellbeing centres. I'm aware they're not all open during this COVID crisis, but there is one centre open, one in the north, one in the south, and one in the central of the borough, which access to anyone. You don't necessarily have to be on any kind of early help or social care plan. And they do offer things such as Relax Kids and different advice and support if people need it. There's also the youth service, and the youth centres have tried to keep as much as possible going post 5 p.m. They're still offering support. If young people are sort of concerned about shopping or prescriptions, and they perhaps live with, the person they're caring for is vulnerable or shielded, there is Sefton COVID-19 support, where people can ring up and get support for shopping, picking up prescriptions, or even a chat. I'm not sure that it's specifically related to young people, but I can certainly ask that question, whether there's more we can put in place around that.
Thank you. Young carers are obviously caring for very vulnerable people who have been shielding or maybe shielding under the new criteria. Can young carers get priority appointments at GPs to maintain their own health?
I think that would very much depend on your individual GP's practice. So I wouldn't really have an answer to that. It may be worth sort of getting in touch with your local GP surgery to find out what they can offer. Or again, it's something maybe the Sefton COVID support team would be able to assist with.
Young carers are not able to visit people in facilities such as rehabilitation centres or care homes at the moment. Can you explain why?
Again, this is sort of the government's idea for putting these guidance and rules in place is around keeping everybody safe, possibly, not just the young person, but their loved ones, staff in the facility, and other people. It's very frustrating, but it is, those guidance is there as a necessity to keep people safe.
Okay, thank you. Obviously, with the new information about the COVID vaccine coming out, will young carers be on the priority list to have that vaccine, as currently the information seems to be circulating around that it's adults only?
I can't actually give I can only give the answer of what I've known and seen in the media. And I know that certainly the World Health Organization is saying at the moment that the vaccine won't be given to young people initially. And, the first priority will be for the elderly, people in care facilities, key workers.
Okay. Young carers feel very worried about the people that they're caring for, particularly they don't want them to miss hospital appointments themselves or GP appointments. Can a young carer attend an appointment, a medical appointment with the person they care for to support them?
As far as I'm aware, most hospitals and sort of outpatients departments are limiting who can actually attend appointments. It may be possible that they could actually travel with them to the hospital, but it's more than likely that they probably won't be able to go into the appointment. Again, this is something that's probably worth discussing with the health professionals that are around the family.
Okay. Do you think that the social care system at the council, and obviously within the health service as well, truly appreciates the role of young carers and the impact that young carers have supporting the person that they care for, but also how it impacts being a young carer on themselves?
I would certainly like to hope they do, but I still think that there's a lot of you know, we need to continue to raise awareness about the role that young carers play and the impact that the caring has on their whole life and the whole family, and ensuring that young people's, the council particularly, like social care and early help, you know, it's good practice to ensure that young people's views are not only heard, but they're listened to and acted upon. So that's something that we have to keep at the centre of our practice, I think. Okay.
Christine, thank you very much for your time today. I think that's all our questions, unless there's anything else that you want to add in for young carers right today.
No, nothing really, only to sort of reiterate what I said about it being important to make sure that we keep it at the top of the agenda, particularly making sure that we're listening and hearing what young people really say and that their views are respected and acted upon.
Thank you very much. Thank you.